Hello friends, welcome back to the next segment of reading. So far we have been going into details of each pillars of reading. First we saw all about phonemic awareness, and next we saw about the phonic instruction, and the third pillar which we looked into detail was fluency instruction. Now in this segment we will be looking into aspects of vocabulary instructions. We will see how vocabulary plays an important role in reading and how it can be enhanced in a child. Now vocabulary instruction aims at language development. Vocabulary is a set of words that the child right from his young age develops and stores and uses it in his normal everyday life, and this is what he is going to use it in his examination too. So, vocabulary development plays an important part in reading, for the child has to understand the vocab in context. Now, for vocab development we will be starting with by taking a topic or an idea. Then we have a brainstorming session with our children about the topic that we will be discussing with them at length about the topic or the idea. After the discussion, we arrive at the main word. From there, we go on to the associated words and these associated words are going to be obtained from the children. From associated words, we can now segregate them into action words, naming words. As you all know, naming words are nothing but nouns which indicate the person, place and thing, right. And from then on we can do a whole lot of activities with them, like opposites, which we have shown it as antonyms and synonyms, and then matching exercises. We can play lot of reasonings in the form of analogy exercises with them, and we can also arrive at the cause and the effect. Again, the children are made to think here. We are not only building vocabulary, but we are also enabling the child to think as to why this is happening and what could have been the cause. From then on, we can also get into the noun and verb agreement or subject verb agreement. So, this way a vocabulary development as a whole can be played or even had with the child. Now, for doing this, we use something called a bean bag. This bean bag is made up of seeds of tamarind, and they are just made into a bag, and this gives you a tactile sensation. As and when, as a teacher, I am going to elicit words from a child, I am just going to throw this bag, and the child is expected to catch the bag and answer or give out the associated word. So, what does this do? First of all, the child pays attention. So, the attention of the child is sustained to the activity that is being done with them. The next one, the child hears auditorily, he is going to hear the question, and at the same time he is going to process the answer in his mind. The third thing, he will be anticipating whether the bag would be coming to him. And fourth, he would be ready to receive the bag, that is, catch the bag. And last but not the least, as he has processed the answer, he is expected to give it out orally and at the same time throw the bag to the teacher. So, look at all the areas that we have covered, and this is played as a game. So, this gives him a lot of other essential skills that are also going to be built along with the vocab development that is happening, is not it? For example, now we are going to start with the word hospital. The moment I give out a word called hospital, what is it that comes to your mind? Yes, when we say hospital, the moment immediately the word that comes to our mind is doctor. Let me write that. When we say doctor, what's the next thing that comes to your mind? Come on, let's all start thinking like a child, shall we? Yes, it is patient. Now, can we all imagine a doctor? Yes, doctor has come to your mind. What is it that he is wearing on his neck? It's an instrument. What is it called? It is called stethoscope. Yes. Right. Now, can you just think of a person who will be next to the doctor always? Sometimes we call, he uses him or her for help. Yes, that is nurse. Now, as a child, what will the nurse give you immediately when you go with a fever? Yes, it is injection. Before giving injection, something the doctor will use to ask you to keep it in your mouth underneath the tongue to find out your temperature. What is it called? It is thermometer. And the nurse will give you injection. Now, we are going to go a little higher for the child, if it is maybe 3rd or 4th grade. When we go to a doctor only for a fever, see, we visit a doctor in a hospital and we go to him only for fever, what are we called as? Yes, we are called patients, but in that patients itself, there is a difference. What are we called as? Yes, we are called outpatient. Sometimes just an injection or just a fever is not going to be sufficient. We might not be going for a fever, we might be going for other ailments too. In such cases, what is it that our doctor asks us to do? Yes, he takes X-rays. Now, when we have taken the X-ray, where do we go and take X-rays? Sometimes we might be asked to do our blood work too, right? Where do we go for all that? We go to a place called lab. Of course, in schools there are other kinds of labs, like you have a chemistry lab, you have a physics lab, you have a math lab, you have an English lab, right? So, there are different types of labs which are there in the school, but this place in a hospital where there is a lab, we go and get our tests done. This is where the doctor sends us to get our tests done. Now, having seen our X-rays and our fever or any other ailment, what is it that the doctor does? He prescribes medicines. What does he do? He gives us medicines. When I say prescribe medicines, he gives it in what? He gives it in a paper, isn't it? It will have a letterhead, his own letterhead, where his name, his registered number, his qualification, all that will be listed. What is it called? It might even be the hospital letterhead. What is it called? It is called prescription. Yes. After, suppose, now all outpatient. Now coming back, once they give us medicines, where do you think we will go and get? What is it that your children will say? Yes, medical shop. Another name. Now we are going to supply this word to the child. It is called pharmacy. What is it called? Pharmacy. Now all these activities are pertaining to an outpatient. What is the opposite of out? Yes, it is inpatient. When do we become inpatient? Maybe a child will say, maybe when an operation is done. What is another name for operation? It is surgery. Now, who does the surgery for us? What is he called? Is he called a normal doctor? Yes, we call him doctor, but he has a name. What is his name? He is called a surgeon. The moment I have surgery, how am I taken in? What comes to your mind? Yes, wheelchair. And a surgeon, right, a doctor, when he does a surgery, what does he use? Mostly it is cut and done, isn't it? Surgery is nothing but cutting a part. But what is it? He uses something to cut it, cut one part of her body, or a leg or a stomach or wherever it is. What is it called? Your child might answer that it is a knife. But is it a knife? No, there is a new word. That instrument is called scalpel. After having done our surgery, there is something like they keep a mask, right? What is it called? They provide oxygen to us. It is called an oxygen cylinder. Where else have you seen oxygen? Yes, you know that oxygen is important for your body, and you can even give out the formulae for it. And cylinder, immediately children will say gas cylinder, because that is all that we know. We cannot expect a child to know an oxygen cylinder, but the child knows what a gas cylinder, because it is being used in a daily life. They see it in their kitchen every day. So, we can even connect it to that. Now, we have been talking about an operation being done in an hospital, right? Now, what does the doctor use other than the scalpel? He wears something. Yes, it is called gloves. Where else do you think we will use gloves? Or who else uses gloves? Yes, a plumber uses gloves when he does the plumbing work. And now, what is the place where the surgery is being done? What is that place called? It is called a theatre. Where else have we heard this word theatre? Yes, of course, we have heard about the movie theatre, which is very common, and that is because children are exposed to the word theatre through movies. So, but that they do not know this is also a theatre, where the place where the surgery is being done, right. It is called an operation theatre. Of course, it is, to be very precise, it is an operation theatre, but generally the place is called. See, for getting a surgery done in an hospital, the first and foremost thing that we have to do is getting admitted in the hospital. So, that is called, we also would have filled in forms and lot of procedure. It is called admission. And generally what happens after having undergone a surgery, you are now kept in for an observation in a place called intensive care unit, which is called an ICU. Instantly your child will also come out with some thing called ward boy, stretcher, because once a surgery is being done, you are taken in a stretcher. And of course, they might even come up with the canteen, because that is another important thing that is in the hospital, right. So, this way, with taking a particular word, okay, and having described the scenario with the word, and after having brainstormed with the children, we can bring out so many words that the children, some of them might be new to the children, some of them they might be knowing in the colloquial terms, and some of them they might already be knowing, but we have now used them in context and we have made them understood, or the exact word and its usage, and we have also expanded their vocabulary. Have this as a clip. Shall we see how it has come out? So, we have got lot of vocabulary relating to hospital from the children. Now, we can ask them to select a few words out of one particular. From this, we are going to form a subcategory. What is it that we can do? We can do an outpatient department or OPD. Now, from this, what are those words that are going to come or can be categorized under outpatient department? What is the first word that comes to your mind? Yes, doctor. Yes, nurse. Yes, medicines. Then patient. One more word, pharmacy. Fair enough. See, from the vocabulary bunch which we have obtained from our children, we are able to now get into subcategorize it. So, we can now get into much more details and make it into smaller chunk or smaller segments, so that they understand that they can make units or categorize them. So, indirectly we are teaching them how to categorize, aren't we? Now, can we have a look at it? See, from whatever that we have obtained, we have now subcategorized it into surgery and outpatient department, and those words which are connected to surgery like theatre, surgeon, gloves, scalpel, ICU. In fact, I have taken here only a few, maybe you can get into more details, you can have sub arms or sub leaves too. For example, I mean we did see what are the words that can be categorized into surgery. Now, in the same way, outpatient department, we have first registration, then we have doctor, then we have X-ray, and we have prescription where the doctor writes in the medications that are for us, he prescribes the medications in the prescription. Then of course, we go to the pharmacy to buy those medicines, right. In this way, the children are taught to first obtain all the words, and from the words how to narrow it down into various categories. Now, we can just move along to say what are the activities that we can do with from the words that we have got from our children, right. Similarly, you can build up lot more vocabulary. Suppose when I say I can just take a word called doctor. So, for each there are different kinds of doctors, an orthopedist, a cardiologist, a gynecologist. You know, you can start building on those lines depending upon the age or the class of the child. So, and take each and every word in the similar manner and then start getting into building more vocabulary and subcategorize them. So, for example, in this sector like OPD, in this segment we have a word called prescription. Now, what do we do when we are given a prescription? Yes, we have to buy the medicines that has been written there. Where do we go to buy the medicines? We go to the pharmacy. In local terms, we call it the medical shop. But this entire action of going to the pharmacy to buy the medication has a term called filling up the prescription or fill up the prescription. So, this is an extra bit that you can give it to your child. It need not be written, it is all oral, right. Later on these children will remember all these things and then they will produce it at any point of time, maybe in their written work. Now, let us move on to the various activities that we can work or build with our children using this vocab development. In the initial stages, we saw there are so many activities that we can do like antonyms, synonyms, matching, analogies, cause and effect. Now, shall we try some of them with our word hospital? Now, for bringing out the reasoning, let us start with analogies. So, I am going to take theatre. Theatre is to surgery. Now, what will be is as medicines is to what? Can you guess? Yes, it is going to be prescription. Now, if at all we are going in for opposites for lower classes, when I say outpatient, what would be my opposite? Yes, it is going to be inpatient. Right? It is quite simple. This you can do it for lower class children. Yes. Now, can we take up the word admission? What would be the opposite of admission? Can we locate it here? Yes, it is discharge. Similarly, you can have lot more activities done with your child using a particular word and getting the vocab from them. In this segment, we saw all about vocabulary development and we saw why it was also important. In the coming segment, we will go to the next pillar and learn all about comprehension. Thank you.